Good morning, everyone. As Lawrence said, I'm Dr. Consultant. Um, I hope you all enjoyed your Friday night last night and, had your alcohol moderately and never got into any trouble. And it's a bit odd to actually talk about alcohol first thing in the morning, isn't it? And I don't know how you feel about this. I've been actually telling people, don't drink first thing in the morning, don't drink alcohol as first thing. But it's okay to talk, sometimes, This is not as bad as drinking first thing in the morning. Okay, I'm going to give you some facts. Before I'm just going to give you some introduction about alcohol. Alcohol is actually, we know that it's actually been there for centuries, and it's part of many cultures. We use it to celebrate, we use it to socialize, and it enhances, in certain cultures, even religious ceremonies. And we all know that drinking too much, it's actually on a single occasion or over time can have serious consequences for people, and it can cause accidents, and you know that we can get addicted. But that's only part of the story. In addition to these serious problems, actually, alcohol can damage our internal organs, damage our immune system, and even actually cause cancers. But how many of you actually probably are aware of this? That's what I'm going to talk about more about the medical complications, along with how it causes addiction to people. But it's much like smoking. It actually can affect different people differently. Genes, environment, even diet can actually play a role in whether you can develop an alcohol-related disease. And research is also coming out that small amount of alcohol we drink can be actually good for your heart. It can be very controversial as well. So I'm going to touch upon all those issues in my talk. So to stay healthy and to decide what role alcohol should play in your life, I think you need very accurate, up-to-date information based on research, not just based on opinions. I know, several people have opinions about alcohol, but you need to have some facts. So during the next 25 minutes, I'm just, planning to burst certain myths about alcohol that can mislead people. And you can sometimes call this FAQs, and I'm just going to answer those FAQs. Okay, these are the myths I'm going to talk about. Let's just talk from one by one. The first one is, alcohol makes me high. People say that all the time. And I've been asked by people all the time, whether I'm in the clinic or I'm with my friends or family, because they think that I know everything about alcohol, because they think I'm an expert, but I'm actually not. I'm like you, learning every single day about alcohol, because there's a lot of research coming out every day. Every day there's a new update on a new understanding of alcohol. So people always say that, is it just, people think that it only causes euphoria. People take it for euphoria, just making them to feel high, but actually it is not true. I've heard actually patients saying that after a brief high, they feel very depressed, they feel suicidal, and some of them will say that, well, doctor, I thought of actually gulping all my sorrows with a glass of wine, but you know what? After some time, I felt very depressed. I felt like jumping. I know why. And recently, and we have 2 calls, crisis calls from patients actually, our patients, and we had actually called the police, actually bring them into a hospital to save them from the corridors of death. I said they just threatened that they were actually about to jump. So what happened? We brought them in. We assessed them, actually admitted them in the observation ward, and after 6 hours, their mood improved, suicidal thoughts disappeared, they happily went home. So this is what the alcohol causes. Initially it can cause high, but eventually it's actually a downer. It can cause sedation and drowsiness. In higher concentrations, it can actually cause death. Because alcohol can actually affect your brain in many different ways. I'll talk about it later. So before you think, before you start drinking, you have to think twice as to, whether it's going to make you happy or not. Probably won't. Most will experience it. It will just numb. I got numb. I don't get the high, but I'm just drinking to just numb my feelings. Just briefly, I can say, the high, you get in the beginning, it could be due to the certain chemicals that are released in the brain when you exercise. There's something called endorphins. And there's something called pleasure-releasing substance called, dopamine. You know, it acts on those chemicals and increases their amounts in the brain initially for a short period through its indirect effects. That's why you get the high of euphoria. But later, through its complex mechanisms, it actually interacts with various other neurochemicals, and that, as a result, you know, it suppresses the brain, it slows your brain down, and causes various other mood changes, and particularly depressive mood. Okay. If you drink daily, you're an alcoholic. This is again, you know, this question is being asked all the time. You know. Actually, the answer is it's not true. If you drink heavily, I don't think technically you are really addicted. You might have seen people drinking very moderate amount of alcohol after work for many years. I've seen. Are they all alcoholics? Actually, the answer is no. Then I have seen people binging for a period and then stopping it for several weeks. Again, they are not actually, by definition, alcoholics. They suffer with alcoholism or alcohol dependence. I'm going to use the word alcoholism for alcohol dependence just to make you understand it better. So when does actually it becomes alcoholism? It means actually psychological and physical dependence. It's not based on how often or how much you drink. It's actually when your impulsive, periodical use of alcohol becomes compulsive. You have to drink it every day. That's when it becomes an addiction problem or alcoholism. And moreover, if you're persistently drinking, you know, despite facing adversity, that's another key issue. And the other issue is the craving. You know, constant urge to drink wherever you are, when you're working, when you're at home or at school, if you're a student, if you're thinking constantly at lunchtime, actually, where can I buy the alcohol? When can I buy it? You know, when can I have the drink? That sort of craving, if you have that, if you develop that, that is a sign of alcoholism. So I'm going to actually, we will see in the next slide about what are the the real signs of alcoholism that you should be aware. This is actually from our diagnostic classification criteria. This is what we use, to diagnose alcohol dependence. So number one sign that people will experience is tolerance. Tolerance means, people have to actually drink gradually over a period, actually get the same. Right? They will start with a glass of wine to start with, and after a few years, they will think that, oh, this is not enough for me. I have to drink more and more. And at some point, they'll be drinking a bottle, even 2 bottles a day. And still, they won't be actually getting the high. That means a tolerance. That means your brain is trying to adapt. Then, if they don't drink, they struggle with withdrawal symptoms, both physical and psychological. Physical means, if you don't have a drink, first thing in the morning after a heavy night's drinking, you feel a bit jittery. You just feel sweaty. You panic. You feel irritable, and that's all the physical and psychological symptoms. You struggle with insomnia, and your mood will become very irritable and anxious. Some people may not have the withdrawal symptoms, because of the fear of the withdrawal, they will continue to drink. So even the fear of withdrawal itself is a classical sign of alcohol dependence. Then, as I said, the craving will make you actually, to go to greater lengths actually to spend time on alcohol. A great deal of time is spent in activities necessary to obtain alcohol, and persistent desire or unsuccessful attempts to cut down or control your alcohol use. And because I've been drinking heavily for over the years, and what will happen is, you lose your focus on your social, occupational, or recreational activities. Either be given up or reduced because of the alcohol use. And moreover, that, it's not that people have to tell you about this. You know all these problems, and despite that, you will continue to drink. That persistence, that persistent, compulsive use, the craving, the withdrawal tolerance, those are the classical signs of alcohol dependence. And it's needed to say that this is a serious problem. It is a sign, it is a sign that, your brain had gone through some significant functional changes, resulting in a disease form due to this prolonged exposure of alcohol on your brain. By saying that, I'm not just simply medicalizing, it is actually a fact based on the research coming out. And at this stage, I would consider this as similar to any other chronic brain diseases or any other chronic medical diseases like hypertension or diabetes. You will see a relapsing and remitting pattern of illness once you reach this stage. And if you ask me, among people who seek help in our department, almost all of them, almost near to 100% actually belong to this particular group. And as I said, it is an end-stage disease, and once you reach this stage, your whole world turns upside down, and the road to recovery is pretty long. But if you ask me, how many of, actually these people in the community, there is a survey actually done recently in Singapore. It says about 0.5% of people in the community who struggle with alcohol dependence. Maybe more, we don't know, because not many are actually coming to seek help. But there is another big group, actually, in the community who haven't reached this stage. What we call it is people who just abuse alcohol. They haven't actually developed a withdrawal and tolerance. We can call them, we can put them in this big group of alcohol abuse, which I'm going to talk about in the next slide. So what is alcohol abuse? So at this point, you're not a social drinker. You've been drinking heavily. But if you had any one of these problems, failing to fulfill any major work if you're a student, going to school, or if you're a housewife, having, being, in a difficult situation to cope up with your pressure at home, or if you have, been arrested for drink driving, or any other legal problems that you face, or relationship difficulties. Any one of them is just enough. Should have been drinking heavy, and you should have faced any one of these. It's enough to say that you're not a social drinker anymore, your problems are getting worse, and you're abusing now. And this is a yearly warning sign that you should do something. And if you ask me again, this group in the community is about 3.5% in Singapore, according to a recent survey. And of course, the survey also unfortunately pointed out that 90% or more, they're not seeking any help. Although I'm saying, they are not as bad as people who are struggling with alcohol dependence. They have the problems on their own. And if you ask me, these are the people who are at most risk to become alcoholics in the end. And any meaningful lifestyle changes at this level is crucial. And being, as I said, being charged for drink driving, any problem with your work or domestic violence, those are the early warnings that you need to actually seek help immediately and shouldn't delay it. And of course, nowadays, we have validated screening tools available to actually find out whether you have reached this stage or not. There are free tools that are available in the online web as well, so you can actually download and check it yourself to see what is the score like and what you should do. There are tools like Audit, which is a validated tool. People use it regularly to assess their level of drinking and the problems they face. And in Singapore, you can go to GP. GPs have recently actually trained them actually as to how they can use this tool to screen for early detection of this problem so that they can be given the right help as soon as possible. They can go to, or you can, come to us, call our helpline, and we will do the assessment for you and then do the right treatment. And of course, worldwide, people are worried about this big group, alcohol, people who just abuse alcohol. And there's something called brief interventions gaining momentum worldwide to address these people, then and there. It's nothing but, screening you and then followed by simply, followed by some 3 or 4 counseling sessions to address your problem. And people believe that research says that it has got much better evidence, and you do something, immediately you control your drinking or reduce your drinking and stop drinking. Myth number 3, people always, some people say, I can drink more than others. This is actually a particular sort of an argument that happened among youths. They can go into this, drink-related games, and I've recently read from BBC, unfortunately, that they said rum death. There was a headline. And then I tried to read it, but actually there was a young student from one of the universities in the UK actually died due to, massive amounts of alcohol that he had taken following a game among their friends. He had actually about more than 2 bottles in a few hours. And after the game, everybody left. This guy was on his own, actually upstairs. When he was trying to climb down, he just fell, had a severe head injury, and he died, unfortunately. So this is it, the young kids will say, I can drink more. But actually, you're not born to actually drink more. It's all about the physiology. So let's talk about how alcohol affects our physiology. When you drink, what happens? About 20% is actually absorbed in the stomach, and 80% actually being absorbed in the upper part of the small bowel or small intestine. And after the absorption, it gets diffused into all the tissues in our body. And wherever the water is more, will get more distributed because it's more soluble in water than fat. So this is the reason why some people can drink more. Because if you look at two people with the same body weight, one is having less body fat content compared to the others, is much more muscular. The muscular person, because of the more water content in the muscles, he may not have the same effects if both have the same amount of alcohol compared to the person with higher fat content. So this is the reason why somebody would think that they can drink more, but actually it's very dangerous. And then with regards to food as well, if you drink or if you eat something before you drink, it can delay the absorption. That's why people say to reduce binge drinking, you can have some food before you go, before you go to the go for your drink. And moreover, if you eat more fat, food with more fat can delay the absorption much more. And of course, with regards to women, women actually they have a smaller body size compared to the men, as well as they have more fat content. So that's another reason why the woman should drink less, because of less water content in the body, because they'll get more blood alcohol level compared to the men if they drink the same amount of alcohol. And that's why if you ask me, the various complications that people with alcohol dependence face, alcohol, cirrhosis of liver, cancer risk and everything, is much more higher in women compared to men. And also in one research says, when alcohol gets breakdown in the body, there's something called acetaldehyde. And this enzyme is much less actually for women in the stomach compared to men as well. This also contributes to higher blood level. Okay, myth number 4. Yeah, I've been drinking daily for many years. It hasn't affected my health. Some people will boast it. I've been drinking. Give me like smoking. My uncle said my uncle smoked for 25 years, absolutely fine. Yeah, it is true, but these are the facts, from World Health Organizations. What they say: worldwide 2.5 million deaths per year due to alcohol. 6% of all male deaths worldwide is due to caused by alcohol. And now the leading risk factor for death in men aged between 15 and 59. And 60 different diseases or injuries are attributed to excessive alcohol intake. And 40% of the deaths are caused by acute intoxication. And it is implicated in violence, drowning deaths, falls, and doesn't stop there. I don't know whether anyone is aware. I know you are aware, possibly mostly aware of the alcohol in the liver, but how many of you are aware of of this particular risk of cancer due to alcohol? Anyone of you? Yeah, I was also surprised. I know it can cause certain cancers in the wall cavity, but when I was reading the literature, I found that it can even cause breast cancer. What they say, about 7 out of 10 patients with bowel cancer are very heavy drinkers. Drinking 5 or more drinks per day can increase your risk of colon or rectal cancer. This is surprising for me. 11% of all breast cancer cases are attributed to the alcohol, heavy drinking. I'm not surprised about the liver cancer, because liver end stage, you can get cirrhosis, cancer, etc. And if you drink and smoke together, of course, the risk will get much higher. So, let's just talk about the cancer. Cancer, actually, there are many factors: genes, environment, lifestyle. 3 major factors are important. Of course, we cannot do anything about the genes. Neither we can do, actually, to do something about the environment. But what we can do is we can change our lifestyle. Particularly, the key lifestyle changes, actually, we can reduce the amount of alcohol that we can drink. Just to give you some more, actually, insight into these studies related to alcohol and cancer. In Italy, a researcher has actually reviewed about 200 studies related to cancer and found a significant, actually, relation between alcohol and causation of cancer. And also, a World Cancer Research Fund actually recently released an information saying they've done a study of, assessing women and linked with alcohol, women and linked with cancer and alcohol. They found a high incidence of cancer among women who particularly drink heavily, which is nothing but a survey of 1.2 million people, actually women around the world, and they have studied their alcohol habits, and they found that, again, it increases about 1.2 to 1.5%, not very high, but still is high. There's a risk there if you drink heavily, and it increases particularly the risk of colon cancer, rectal cancer, and breast cancer as well. Alcohol doesn't actually directly cause cancer. It actually causes cancer by its breakdown products. Particularly I said, something called acetaldehyde. This acetaldehyde can damage the genetic material in the cells. Once the cell is damaged, and it can actually develop into a cancer cell. Similarly, there are some other toxins can also contribute to the development of cancer. And moreover, hormonal effects. I know particularly for breast cancer, they think that alcohol increases the estrogen level. That's why people develop breast cancer. Okay, alcohol and the brain. Immediate effects, people would have seen, people had experienced this, intoxication, or the immediate effect, the binge drink. What happens is slows down your brain. You walk actually, you will end up having walking difficulties. It's because of, alcohol's effects on the cerebellum, the small brain, which is actually the important key brain structure, which helps us, which helps to actually balance our movements. And you have diminished reaction time, memory blackouts, drowsiness, and poor social awareness. And in the longer term, after a few years, it can cause mood, anxiety, and various mental health problems like psychotic disorders. And you can actually suffer with permanent memory loss due to loss of brain cells and malfunction of your neurotransmitters. Again, I'm going to just talk briefly about how this happens in brain due to alcohol. As I said, brain is a bit of a big maze of network of cells called neurons. And neurons are the basic cells. And what they do, they communicate between each other. They actually relay information from one neuron to another. And it is done actually by basically something called neurotransmitters. They convert this, information into electrical and chemical messages. The neurotransmitters, they are very powerful chemicals, and by increasing its amount or actually the way it actually acts on the brain, it can modify all this, the information processing in the brain. So the brain's job is actually to keep all these neurochemicals at balance to make sure that you can function normally. So what alcohol can do is actually if alcohol can slow the pace of communication between these neurons. And heavy alcohol consumption, even on a single occasion, can actually throw this delicate balance, off. That's why, we can have these dramatic major effects in mood, emotions, behavior, and in your memory as well. In the longer term, the research clearly says, the neurons actually, some of the neurons can die, reduce in size, and in the end, brain can actually shrink in size as well. So this is a constant process happening in the brain, and because of this, disruptions in the neurochemicals, brain's job is actually to adapt to this change all the time. So it try to adapt and create it normal, that's what the brain does, and in the end, the adaptation becomes abnormal, and that's why at some point actually you develop alcohol dependence, you develop tolerance and withdrawal. This is the key neurobiological mechanism, that contributes to alcohol addictions according to research now. But good news is that, these changes can be partly reversible. After several months of abstinence, it allows, structural brain changes to partially correct your functions, and some of the functions, your attention, your problem-solving skills, your concentration can improve over the time. Okay, alcohol and liver, everybody knows about this. When you drink heavily, what happens, initially, alcohol is actually mainly detoxified in the liver. So liver is the major organ, detoxifies it. So it goes through something called fatty change, which is very reversible. If you stop drinking, the fatty change will get reversed. But what happens if you continue to drink after some point? It becomes a much more complicated stage. It reaches a stage of alcohol hepatitis where the liver gets really inflamed. It can cause all kinds of physical symptoms. And if you still don't stop, and then it eventually ends up in a condition called cirrhosis. That means scarring. Because of the blocking of fat and various other toxins released in the liver, it blocks all the kind of transport inside to get out of the body, the detoxification mechanism. In the end, because of the blockages, you get scarred, and because of the scarring, you get all the other complications of cirrhosis of liver. And unfortunately, this is a serious condition. It's more like an end stage, and if you don't seek help, eventually people die due to various complications. So again, the good news is that I have to tell you, I've seen people actually even almost reaching there and recovering it after stopping alcohol. So if the key important message is that lifestyle change that you need to do is just stop drinking, and your liver will improve. During the mild and early and not the late stages, early and a little bit further than those stages. Okay, what are the other risks? It can cause hypertension, stroke in the brain. It can cause ulcers because you vomit all the time, you damage your stomach, and you get even vomiting of blood and so on and so forth. It actually affects the immunity and thereby causing infections, and it enlarges your heart. People could die of heart attacks because of that. And it causes nerve pain because of this something called peripheral neuropathy. And if you're pregnant, if you've been drinking heavily, the growth of the child can be affected. Okay, alcohol abuse and alcoholism only affects the drinker. Actually, it is not. I think everybody knows this. You heard it actually, or see it in the newspapers all the time. How often you see the link between violence, or something happens in the brain, something happens in society, and alcohol. So it's again, I actually got it from WHO. Significant contributing factor to child maltreatment. It's a risk factor for being victimized and perpetrating youth violence. And it actually, alcohol consumption, especially at harmful hazards level, is a major contributor to occurrence of this domestic violence. And elderly people are more and more abused in the society because of alcohol. People with alcoholism are morally weak individuals lacking willpower. This is, again, I've been asked all the time. Our families will say, he can stop, but he lacks willpower, he lacks discipline. But actually, it is an opinion, not based on research. So basically, recent current studies are saying that, as I just explained to you, some abnormal neuroadaptations in the brain that contributes to alcohol dependence. And alcoholism is a complex disease that involves a variety of factors, including genetic, environmental, social, and behavioral components. As I said, once you develop alcoholism, it's no different from hypertension or diabetes. It runs a chronic course like them. And all this compulsion to drink, craving, could be all due to the abnormal brain mechanisms. And remissions and relapse are part of the recovery process. Just briefly touch upon the genetic issue. Alcoholism is one addiction where the genetics research has actually thrown a lot of light on this. People are saying even 40 to 60% of the variability you see in alcohol dependence is actually could be contributed to the genetic vulnerability that people face. That means, if you have a family member drinking heavily, your parents or grandparents, there's a high chance that the next offspring can actually develop alcoholism. But that doesn't mean that everybody will. Genes can play a role, but genes are not the only key or the major mechanism that contributes to alcoholism. They found that other factors, if you're a parent with mental health problem, if you've been fighting all the time, very disrupted, family environment, if the parents' alcohol abuse is very severe, and if the parents are abusing alcohol, other drugs, those are all the other factors that can also contribute to your contribute to your vulnerability to develop alcoholism later in life. So if you're worried about this family history, if you want to do something, what you can do is, if you're a young man, if you're a youth, you should actually avoid underage drinking. First, number one is illegal, but then the research shows that the risk of alcoholism is higher among people who begin to drink at an early age. And because as a result of both environmental genetic factors, and drink moderately as an adult. No more than probably one drink a day for a woman or 2 drinks a day for a man. And some of the people shouldn't drink at all. People are on medications, people are pregnant, they shouldn't be actually drinking. Also, people got a previous history of heavy drinking. They should really think twice about moderate drinking or controlled drinking, because they always stand a higher chance of relapse compared to someone who hasn't had those problems. If you are in doubt, just talk to a health professional like us to get more help. Okay, myth number 7, alcoholics are all the same. Actually, again, based on our clinical experience and research, we do see difference in people's presentation when they come to seek help. Some are like very young, starting from the age of 12, 13. Unfortunately, the prognosis is much worse for these people. Some of them are late drinkers, like after developing alcoholism after stress or some financial or employment problems. Those probably, I would say, relatively stand a better chance of recovering early compared to the people who develop much earlier. And some people use as a self-medication. If you have a social anxiety problem, if you want to talk like me, in front of audience, you work in a place where you have to give presentation all the time, but have anxiety. What you do is just drink to just calm your nerves down, and eventually you actually develop alcoholism. And people with mood problems, depression is very common. People with manic depression, they are vulnerable to develop alcohol dependence. And alcohol also can cause psychosis, at some point. If you drink heavily over a period, it can actually contribute to some major severe psychotic illnesses. So treatment has to be individualized. Not everybody will fix the same bill. But we need to actually think according to how you present. If your mood problems are the prominent feature with alcoholism, I have to treat your mood problems along with your alcohol dependence, and so on and so forth. Okay, the last myth is actually people don't recover or there is no cure. This is also not true. Yes, it is a chronic illness. It takes a long time for people to recover, but I've seen people actually, like in Monopoly, getting out of jail, reduce their drinking. Some people actually, their health complications have improved. I've seen improvement in mental health. And I also agree, some people have told me, look, I can't stop until I see the coffin. I've seen both extremes. So which is why, your engagement, your lifestyle change, your insistence on treatment is key to actually have good success with treatment. People do recover. I think some may just simply need professional help. Just one setting might actually stop them from actually drinking. I've recently seen a patient at our community wellness clinic. He was drinking heavily for 30 years. And then he went to a doctor, medical doctor. He said that you've got peripheral neuropathy. You've got to stop now. I'll refer you to nurse. He came to see me and our counselor. We had just one session. He stopped it for 5 minutes. I was a bit surprised. But he's not the typical patient. The typical patient is actually who comes, who relapses, and maybe it's relapse with remedies, who needs more intensive counseling and other support. Some people will need more extensive integrated family and social support. Some people, as I said, need a lot of support for the mental health, and so on and so forth. Some people will need actually support in the community through these halfway houses, and AA. AA is actually is there for many years around the world, and we do actually try to link up with their services, in order to improve the outcome for our patients. And also, as a doctor, I get the buzz, if I give a medication, when it improves people, it stops people from drinking, I get the buzz. But as I said, there are medications that are available, but I wouldn't actually say this is a major answer to alcoholism. Medications like naltrexone, diazepam can help, but it has to be combined with other psychological help. So the take-home message is all this is going to work if people actually engage and regularly with the treatment, also are ready to actually make essential lifestyle changes. Okay, a couple of slides about youth and heavy drinking. What are the risk factors for youth? I think this is a serious problem that everybody faces, the governments, the communities, the parents now. It's a burning issue because, we are going through changing times, and we have more liberty as a community, people are accepting a lot of things now more readily than in the past. So why? Number one is a genetic factor. As I said, if there's a strong family history of alcoholism, if you're a young man, you're going to drink heavily from early age onwards. And similarly, there's certain personality traits, impulsiveness, aggressiveness, antisocial behavior can contribute. There are certain medical illnesses like, psychiatric illnesses like ADHD, depression can contribute. And family environments, they're not suitable, give you a lot of favorable attitudes towards drinking and lack of support, you're going to drink heavily. And acceptance by your peers, and also if you had unfortunately faced some childhood trauma, that can also contribute to heavy drinking in the youth. So what can we do? Parenting style is very crucial. And research says that we have certain kinds of parenting style. When you can see it in the parents. One is authoritarian, means you give a lot of discipline, but you don't give the warmth and the affection when the kids need it. Like, for example, like PSLE 2 days ago, if they had actually had some bad grades, you just yell at them, caution them, why did you do that? You discipline them. But when they got the good grades sometime before, you wouldn't have actually given the appreciation, warmth, or love. This kind of mixed message. This can actually contribute to some stress factor and later on to push people towards alcohol abuse. There are other styles, neglected style, a permissive style, also not very good. One style they think is more important, which can help people actually to exert some control, at the same time make some meaningful, changes in young kids' behavior towards alcoholism. Authoritative means, both are equal. It should be disciplining him. You should set boundaries. At the same time, you should show warmth and affection needed whenever it is needed. In fact, there's a study actually done in America saying what actually the kids wanted from the parents. In what areas in their life, they wanted the parents to say something. They looked at the clothing style, what clothes the kids should wear, and what school they should go to. And they said about 18 or 20% said, parents should have a say on this. But guess what? 80% or more said the parents should have a say on how much I drink. Should I drink or not? So my message is that you should talk to the patients very early to get an idea of what the kids want, and you should set boundaries very early on, and also establish policies early on, and you should be consistent in setting expectations and enforcing rules. and work with other parents. Work with other parents to monitor where the kids are gathering and what they are doing. Being involved in the lives of adolescents is a key to developing them safe, keeping them safe, and working in the community. You can be a little bit more proactive, actually joining other local families and say what we can do actually. You can even start some talks, discussions in the local area to reduce the binge drinking that is prevalent among the youth today. And as a government level, I noted that in Singapore, HPB has done, this is my last slide, sorry. SPB has done fantastic work. What I found is, they are working more closely with Ministry of Education. So they provide a lot of information about alcohol abuse in the curriculum for primary and secondary schools. They have been running a lot of interactive seminars for pre-university students and actually for students who are going to institutes of higher learning about alcohol abuse. They have read a lot of peer-led programs and reached SAF and other community agencies. And I also looked at the website. They have this 2007 dietary guideline, which tells you clear-cut advice to parents as to what they should do to prevent, their kids getting addicted to alcohol. Also clearly says the cutoff age before people with 18 years of age and below, they shouldn't drink. And they have run actually various capacity-building workshops to equip youth workers, and they have also organized several annual campaigns on the harmful effects of binge drinking. They have partnered with night entertainment outlets. So it's a fantastic work. They have been still doing it to minimize the problems that our youth face in Singapore today. So in conclusion, alcohol means not always happy-go-lucky feeling as people may think. It can seriously affect your lives. If you want to drink in a healthy way, then you have to maintain healthy lifestyle too. And you cannot just simply drink within your normal limits and hoping that it will save you from heart attacks. Do try to lead a balanced life. Then, if you notice any concerns about your alcohol intake, or in you or in your friends or family members, help is available. And please do not hesitate. We can certainly get you back on the road to recovery and call our helpline. With that, thank you very much for listening. Thank you.